Welcome to this training packet for the ALLTEST pregnancy test cassettes. You'll see in front of you the standard packaging box of 40 individually foil wrapped cassettes with a standard CE certification on. The batch and lot number will be on the end. This particular lot is for an FHC 102, which is the catalogue reference for the standard 25 MIU. The cassette loaded with an Ultra 10 MIU is prefixed with a U, so that would be FHC U102, signifying the ultra sensitivity of 10 MIU. The procedure and protocol in terms of running these tests is identical whether they are ultra or standard membranes. So what we're going to do now is just break the security seal on this pack for you and show you the standard packaging contents. Yeah, not that easy to get into. Now, it failed abysmally there. Let me get a knife. Okay, that was a slow way of opening a carton. Here we go, individually 40 test cassettes in standard ALLTEST foils. Standard testing instruction outlined on the back, and you'll also get one of these, which is the full manufacturer's original data sheet. Runs you through all the principles, process and possible interactions and sensitivities. Gives you all the data in there that you need to know about accuracy and selectivity. The basic guidelines that you get back on the foil, on the reverse of the foil, are worth looking at. Basically, when you're ready to run your test, the procedure is to, using the pipette, which is actually packed in here. When we open one of these, we'll show you the pipette that comes with it. You take 3 drops of the urine sample and add it into the sample well. You then, on the test cassette, have marked both a C and a T line. The C indicates the presence and location of the control line, which must always form for you to interpret a result, and the T indicates the present marker for the test line, where that will form within the results window. So positive result is indicated by the presence of a control line with a T line at the specified read time, and it doesn't matter whether the T line is very thin or faint, as long as there is a clear discernible pink T line, then that is a positive result. The higher the levels of HCG in the sample, the quicker that will form and the stronger the colour density. But you can't absolutely interpret the relevant result levels of the beta HCG, so you must interpret the results as a clear positive or negative. So a negative result is indicated by a clear T line and the absence at 3 minutes of a test line. The read time for these test cassettes is very important. What I'm going to do while I'm talking to you on this test packet is just open one of these up, and you'll see inside what you get is your pipette. Let me just move those out of the way so this shows better. That's your sample pipette. You get your test cassette, which is there, and also in these bags, which confuses some people, this is a little pouch of desiccant, which is to keep the test absolutely dry while it's being stored. Now what I'm going to do here is simulate running of a test. The urine sample can be collected anything up to 24 hours before you run the test and stored at normal room temperature. So there's no need for your samples to be refrigerated, and the manufacturer's specificity is actually quoted at room temperature, although again, if the sample is just produced for you, there's no scientific evidence to suggest that the accuracy of these tests in any way is lowered by using a body temperature urine. So we're going to put 1, 2, 3 drops of urine into that sample well. This is simulated urine, this is just water that we're using here, but it will show you the process. And if I can focus in on that, let's see if we can do that, so that you can see this in slightly better definition as it runs, because I'm going to continue to talk to you. But what you will see running there is the sample running through the sample, from the sample well through the results window, and this pink dye travels up towards where the control line at the far end of the test cassette is formed. Important thing is the read time for these results. You read this at 3 minutes. That is very critical, because you're not looking for a test line to form all the time in these results. A lot of them you're going to be testing in clients that aren't pregnant, and you want to give them that full 3 minutes for the test line to develop. In women in the first trimester of pregnancy, when beta HCG tends to peak before it drops off, you will see that the test line forms much quicker than 3 minutes, and obviously that gives you a clear indication as soon as you've got the control on the test line. If you get the test line forming earlier than 3 minutes, job done, positive pregnancy test. But for the results that come and look like what we are showing you here, where you've got a clear control line but there's no test line forming as you would expect on a water sample, then you must give it the full 3 minutes and read the results showing at the 3 minute time. And the importance of that is, with some of these membranes, if there are lower levels of HCG, 3-4 levels in the sample, and they are left moist, and you leave these for half an hour or an hour, you can continue to get some binding forming, so that when you come back to look at these 20 minutes later, 30 minutes later, you might look and with the eye of faith see a very faint test line. These are sometimes referred to as ghost lines in the past. These very, very faint lines really have no significance in terms of your interpretation of the pregnancy test result. You're looking for a clear 2 lines at 3 minutes for a positive result. If you are in any doubt about the presence, thickness, colour density or formation of a test line at 3 minutes, the advice should be send the client away, ask them to return with a further sample of urine between 24 and 48 hours, ideally 48 hours later, and to retest at that stage. Particularly with the 10 MIU ultra-sensitive membranes, even if you're getting a very thin line on the first test that you do, you should be looking for that to form quicker and be thicker after 24 or 48 hours. Beta HCG will approximately double in urine per 24 hours of a progressing pregnancy. The one consideration that you have to put in play with these test result interpretations, when you are testing very, very early, and by that we mean between 7 and 10 days after the possible conception, which would be 2 to 3 days before the expected miss period, and you're getting test lines forming, a percentage of those may not properly implant and proceed to a full pregnancy. So that is where you will get a very small percentage of positive, very early ultra pregnancy test results which subsequently turn negative. Now these are sometimes referred to as test failures or false positives, but in fact what is happening is early implantations which are failing and are effectively miscarrying, and that don't continue with placental development, and hence the beta HCG falls away back below the 10 MIU cutoff. So what you're looking at now, just to go back to interpreting these results, you've got next to the C area a very nice clear pink control line. There is absolutely no T line formed in the test line, so this is a negative, clear negative result at 3 minutes, and in this instance that's what you'd expect on this sample. In a positive test you would see a further line closer to the sample well against where the T is indicated on the cassette plastics, and that would be a positive result. Okay, so that's the ALLTEST Ultra and Standard Beta HCG pregnancy test cassettes.